All right, we'll go ahead and get started. Some people may be still coming on, but we've got some information to cover, so we will go ahead and get started. A couple of quick things before we get started. If anybody has any problems with the volume or hearing me, please let me know. You can simply unmute and let me know, or you can type anything into the chat box and we will take a look at it. We will be pausing at different parts of the presentation for people to ask questions. Again, if you have a question, you're welcome to type it into the chat box at any time and we'll address it at each section when we take a pause, or we will allow you to unmute and simply ask your question. This presentation is being recorded, and this recording link should be sent to everybody in the next day or so. If you wanted to get a recording of the presentation, I also sent an email out about 20 minutes ago with the handouts for this presentation so that you could follow along or have those for reference after the fact. And I think that's it. So let's go ahead and get started. So thank you for joining me tonight. This is part 2 of our Medicare 101 4-part series. Tonight, we're going to be talking about Medigap and Medicare Advantage plans, what they are, how they work, and what the difference is between them. My name is Roma. I'm with the Area Agency on Aging through the Pikes Peak Area Council of Governments, and I am the coordinator for the SHIP program. At the Area Agency on Aging, our mission is to remove barriers to independent living. And we do that by coordinating and developing comprehensive systems of services for older people in the Area Agency on Aging's 3 primary counties of service, which are El Paso, Park, and Teller County. But again, I am with the SHIP program through the Area Agency on Aging. And the SHIP program is a federally funded assistance program that's designed to be free and unbiased and provide in-depth information and education on all things Medicare. That includes all parts of Medicare, all Medicare insurance options. We can also help counsel people on what options are available to them based on their specific situations and life circumstance. We can also help people apply for financial assistance programs if you have low or limited income. The SHIP program through the Area Agency on Aging serves a total of 9 counties in Colorado. And this slide, I've provided both our local Colorado Springs number as well as the statewide toll-free number. Anybody who calls the toll-free number from anywhere in the state will get routed to the SHIP office closest to you. The SHIP program, again, is federally funded, and there is a SHIP program in every county of every state in the country. Just a quick review of what we talked about last week. We covered Medicare Part A and Medicare Part B, the costs for each, and when to enroll in those benefits, and what those parts of Medicare covered. For most people, your Medicare Part A and Part B, regardless of any other coverage you get, are still considered your original Medicare benefits. But tonight we're going to talk about other options. So yay, now you have Medicare, and now it's time to decide what you're going to do with that. When you have original Medicare, or once you're enrolled in original Medicare, basically you have 2 private carrier options that you can choose from for insurance coverage to go with Medicare in addition to that. And we're going to talk about both of them tonight. The first one is Medicare Supplements, also known as Medigap. So Medicare Supplement and Medigap are 2 terms for the same thing. And we're going to talk about Medicare Advantage plans, which is also sometimes referred to as Medicare Part C. Most of the commercials you've seen on TV for Medicare plans are going to refer to Medicare Advantage plans. In order to have either of those options, you must have original A and B of Medicare, both. Both of these options are regulated by Medicare at the federal level. And there are limited times when you can enroll in these options. And that's what we're going to talk about tonight. We're going to talk about Medicare Supplements or Medigaps first. So what is Medigap? Again, Medigap and Medicare Supplement are two terms for the same kind of coverage. And what it does is it's private health insurance that you purchase from a private insurance company. And that insurance is solely and specifically designed to supplement the costs that Medicare A and B left over after they paid their part first, period. Let me say that again. Medicare Supplement Insurance, or Medigap, is a private insurance policy you purchase from a private insurance company, and it is solely and specifically designed to pick up the balance that Medicare A and B left over after they paid their part first, period. So again, they're sold by private companies. They are regulated by both federal and state laws that are designed to protect the consumer. If you purchase a Medicare supplement policy, that policy itself must say Medicare Supplement Insurance, those three words in that order. The term Medigap comes from the thought process that it covers the gaps in your original Medicare, meaning that it picks up the balances that Medicare A and B leave over after they pay first. And Medicare Supplement Insurance is standardized, meaning there are a limited number of levels of coverage to choose from. And any company that sells this kind of coverage anywhere in this country sells those limited levels of coverage, with the exception of Massachusetts, Minnesota, and Wisconsin, who have a couple of additional levels of coverage that we won't go into. Even though all the companies out there that sell this kind of coverage are selling the same products, the same levels of coverage, price does vary, and costs can vary for many, many reasons. It can vary from company to company. It can vary from zip code to zip code. It can vary from age. It can vary for any number of reasons. But again, they're all selling you the same thing, so it does pay to shop around. To have a Medicare supplement or Medigap, you must be enrolled in Medicare Part A and Part B, both. But if you have other coverage options, you may not need to buy a Medicare supplement or Medigap. It may not be something that you need to consider. For example, if you are already enrolled in a Medicare Advantage plan, you can only have one or the other. You can't have both an Advantage plan and a Medicare supplement, just one or the other. Or if you're enrolled in other Medicare plan options, such as a Medicare savings account, which we don't have in Colorado, or something like that. Or if you have other options through retirement benefits. So if you're retired military, you would have the option of TRICARE for life. You wouldn't need anything else. If you're retired para or federal civil service, or have a retirement health benefit available through a private employer, if those benefits are designed to coordinate with Medicare and they're cost effective, that's all you would need. You would not need to consider other coverage such as a supplement or a Medicare Advantage plan. With this kind of coverage, it is secondary to Medicare. What that means is original A and B of Medicare are your primary insurers, and whatever they leave over after they've paid their part first, a Medicare supplement is designed to pick up. Because Medicare A and B is your primary coverage, it is good anywhere in the United States of America and or our territories with any provider or facility that accepts Medicare anywhere in the country. No prior authorizations required, no referrals required. So it tends to be the most portable option for people who either intend to travel, intend to take extended vacations, that kind of thing. It is the more portable option because you're not limited to networks. So who can buy a Medigap or Medicare supplement? Well, basically anybody who has original A and B of Medicare. So again, you must have both parts of A and B of Medicare in order to enroll in other coverage. And the best time to buy it is usually going to be in what's called your guarantee issue period. So theoretically, you can purchase a Medicare supplement at any time as long as you're enrolled in A and B of Medicare. However, there are some times that are better to try and enroll in a Medicare supplement than other times. In Colorado, we do have a law that guarantees people who are becoming eligible for Medicare who are under the age of 65 the ability to enroll in a Medicare supplement if they choose to do so. Again, it's going to be within a limited guarantee issue period. If you're under 65, becoming Medicare eligible and are interested in this kind of coverage, you do need to be aware that that kind of coverage can be more expensive for people under age 65, based on the fact that if you have Medicare under age 65, it's based on disability status through Social Security, which means that they're allowed to, the insurance companies are allowed to charge you more because you probably have health issues, basically. However, if you get Medicare under age 65 and the premiums for a Medigap or supplement are too expensive at that time, keep in mind that you will get another opportunity to get a Medicare supplement at a lower cost when you turn age 65. So again, the best time or the best opportunity to purchase this kind of coverage is typically going to be in what they call your guarantee issue period. And the guarantee issue period refers primarily to Medicare supplements. And this is a window of time, a 6-month window, 6 months period of time that starts as soon as both A and B of Medicare are in effect. So if you enrolled in Part A when you turn 65, but you continued to work for a couple more years and never enrolled in Part B, your guarantee issue period for a Medicare supplement does not start until your Part B starts, even though you're already enrolled in Part A. So once you have both A and B of Medicare in effect, that 6-month window of guarantee issues, that clock starts ticking. What guarantee issue means is that if you choose to enroll in this kind of coverage during your guarantee issue window, you are guaranteed to be able to purchase this kind of coverage, no questions asked. Why is that important? Because this kind of coverage outside of a guarantee issue period is allowed to underwrite, meaning they are allowed to look at your health history. And if they don't like what they see, they don't have to sell you insurance. So for people with any sort of pre-existing health concern, this window of guarantee issue can be very, very important. And I have people ask me all the time, well, what about, the Affordable Care Act that said insurance companies can't deny you if you have health issues? Unfortunately, for the Affordable Care Act purpose and for Medicaid purposes, that applies. For Medicare purposes, that rule does not apply. So these companies are allowed to underwrite, meaning they're allowed to look at your health history and turn you down if they don't like it, outside of these guarantee issue windows. So again, anybody with any sort of pre-existing health concern would want to take advantage of the 6-month window of guarantee issue if this is the kind of coverage you choose to have. Because outside of this 6-month window of guarantee issue, you are subject to underwriting. And if you have pre-existing health issues, you could potentially be denied coverage. And it wouldn't be usually a matter of they'll take you, but they'll charge you more, because that's not really allowed. It'd be an all or nothing. Yes, they will, or no, they won't. Once the 6-month window clock starts ticking, it can't be stopped. So once it starts, it can't be stopped. You have 6 months from the time your A and B go into effect. Now, there are exceptions to that rule, which we're going to talk about in a minute. But for most of us, once that 6-month clock starts ticking, you can't be stopped. So you'd have a 6-month window to get this kind of coverage with no questions asked. Once this guarantee issue period expires, you would have to fall under a very special circumstance in order to ever have that opportunity again, to have guarantee into this kind of coverage. But there are, as I said, exceptions to the rule. So there are some opportunities, depending on a situation, that you might be able to have another opportunity to be guaranteed into this kind of coverage. Those opportunities are referred to as special enrollment periods. And you would be eligible for a special enrollment period of guarantee issued to a supplement under certain circumstances, such as any sort of involuntary loss of other coverage, involuntary loss of credible coverage. So, for example, if you are on Medicare A and B and you have been using your retirement benefit through the employer, that is a health benefit that has been coordinating with your Medicare, and suddenly the employer has decided that they're going to cut off all health benefits for their retirees. That would be considered an involuntary loss of that coverage that was coordinating with Medicare. Because it's involuntary loss, it would provide you a guarantee issue window into a Medicare supplement or Medigap. If you are enrolled in A and B and you are actively employed and that employment ends and you lose that employer coverage, you're already enrolled in A and B, you lost your coverage involuntarily because you stopped working, you couldn't continue it, you'd have guarantee into a Medicare supplement. And that would include COBRA, and talk about COBRA. Another way to have guarantee issue is with enrollment into a Medicare Advantage plan. And Medicare provides what they call a test drive period. We're going to talk about that in more detail when we get to the next section of Advantage plans, but that will be a biggie. So there are ways that you might be able to get another opportunity to have guarantee into a supplement, again, which is especially important if you have any sort of pre-existing health issue. But otherwise, that initial 6-month window when your Medicare A and B first go into effect are very important and something you need to be aware of. Just like with Medicare, there are some services that are not covered by a Medicare supplement or Medigap, and those are basically going to be all the same services that Medicare does not cover. Again, this kind of insurance is designed specifically to pay the balance that Medicare A and B left over after they paid first. So if you have Medicare A and B and they decide that they are going to deny paying for a service, that means the supplement is also going to not deny paying for that service because Medicare did not pay part of that service first. If you get a service that is not a benefit of Medicare, the supplement is not going to pay any part of that either because Medicare did not pay their part first. Other things that are not covered by supplements or Medigaps are the same things that are not covered by Medicare, such as long-term care or custodial care. Dental and vision are still not benefits of Medicare. Hearing aids, private duty nursing, and then of course outpatient drugs, because that would be covered under Medicare Part D, which we'll talk about next week. Again, I did send out an email shortly before this presentation started that included all the handouts that accompany this presentation. One of those handouts is a document that is put out by our Division of Insurance up in Denver. In Colorado, we are very fortunate that our Division of Insurance takes the time and effort to put this document together. It is incredibly helpful, but not every state gets this. What this is, and this is the cover sheet to it, is the state has taken the time and the effort to put together a list of all the companies that are licensed to sell this kind of coverage in the state of Colorado. So it has put together all the companies, it lists them in alphabetical order. It also provides you with information on potential premiums for the different levels of coverage for this kind of insurance. When I said that there are a limited number of levels of coverage to choose from for this kind of coverage, this is another handout I included in the email. And this is a handout that outlines the different levels of coverage you have to choose from for this kind of insurance, Medicare supplements. Again, these levels of coverage are set in stone. There's about 10 of them. Not everybody will be eligible for all of them, They're labeled A through N, like the alphabet, but unfortunately you'll notice that it's not A, B, C, D, E, F, G, H, I, J, K, because H, I, and J are missing from this alphabet. But I think you get the general idea. So these are the plan levels that any company can offer you as a supplement insurance benefit. These levels of coverage are set in stone. These are the only levels of coverage that you would have to choose from any company. So again, they're all selling you the same products based on this chart here. These are plan levels, so they're referred to as plans, plan A through N. We'll go through these plans real quick, just so that you have a better understanding of what this is telling you. Again, Medicare supplement plans are designed to pay the balances after Medicare pays their part first. So if we go across this chart, you'll notice that every plan level, because these plans are broken down into plan A, plan B, plan C, D, etc. Any benefit listed under the plan letter designation is a benefit that plan pays after Medicare has paid their equivalent part first. So if we look at Plan A, for example, Plan A includes basic benefits, including 100% of Part B coinsurance. What that means is if you buy a Medicare supplement Plan A, that's all the benefit you're purchasing. And what that pays for is the 20% that Medicare left over for Part B services after you've already met your Part B deductible. That's all it covers. Doesn't cover hospitalization, doesn't cover anything else, just the 20% for Part B services after Medicare pays their part first and you've met your deductible for the year. If we look at Plan B Medicare supplement, again, it covers basic benefits, the 20% for Part B services that Medicare left over, but it also covers the Medicare Part A hospital deductible every time you're admitted to the hospital. So Plan B Medicare supplement covers two benefits. I'm going to skip over to Plan D. Plan D covers basic benefits, 20% for Part B services, covers the Part A hospital deductible every time you're admitted to the hospital. It also covers, in addition to that, the skilled nursing facility coinsurance. So again, if you have been hospitalized for 3 days or longer, and you're discharged into a skilled facility for rehab or recovery, Medicare pays 100% for the first 20 days of that rehab stay. Starting at day 21, Medicare pays everything except for a daily coinsurance. Again, for 2022, that daily coinsurance is $194.50 per day. If you get a Plan D or higher, that plan pays the $194.50 per day, or whatever that amount goes up to from year to year, because that amount does increase every year. So with a Plan D Medicare supplement, you get basic benefits, the 20% for Part B services. You get your hospitalization deductible covered every time. And if you have to go into a skilled facility for rehab or recovery, you're covered at 100% for up to 100 days between Medicare and supplement Plan D or higher. Plan D also has a foreign travel emergency benefit. And I really shouldn't say benefit because it isn't technically a benefit. It's more of a reimbursement. You'll notice a few plans have this particular reimbursement benefit. The way it works is if you are in a foreign country for whatever reason, vacation, whatever, and you have a medical emergency while you're in that foreign country, basically, you pay for that emergency while you're there. But when you get home, you can submit the receipt for that medical emergency to the supplement, and they're going to turn around and tell you to submit it to Medicare first. So then you're going to turn around and you're going to submit that receipt to Medicare, because it would have been a Medicare covered service had you been in the United States. But you're sending it to Medicare specifically so that Medicare denies it. Once you get the Medicare denial, because they're going to deny it because you were out of the country, once you get that Medicare denial, you're going to take your receipt, you're going to take your Medicare denial, send it back to the supplement insurance, and they should reimburse you up to 80% of the cost of that medical emergency after a $250 deductible. It takes time and patience and tenacity to get reimbursed for that particular kind of situation. but it is a benefit available. And you'll notice there are a few plans that offer that. Jump to Plan G, Medicare Supplement. G is in goat. It'll cover 20% for Part B services. It'll cover skilled nursing coinsurance, cover your hospital deductible, covers the foreign travel emergency reimbursement. It includes another benefit called Part B excess. And this refers to the way that Medicare doctors get paid. So basically there are two ways doctors get paid. And that basically boils down to how the doctor chooses to get paid. When you have original Medicare and you go to a Medicare doctor for an office visit, basically when you schedule that office visit, you go in for that visit, you show them your Medicare card, you have your visit, and you leave. That provider, that doctor is going to bill Medicare for that visit. Medicare is going to process that claim at 80% of whatever they allow for that service and pay that doctor 80% of that allowed amount directly to the doctor. The balance of 20% would be sent to your supplement. They would pay the other 20% of what Medicare allowed for that service. In that situation, what that means is that doctor takes what they call Medicare Assignment, meaning that doctor is willing to accept whatever dollar amount Medicare assigns for their service as payment in full. So regardless of what the doctor bills Medicare, so for example, if you go to the doctor's office with no insurance, that doctor would charge you $300 for that visit. But you have Medicare. So you give them your Medicare card, the doctor turns around and bills Medicare $300. Well, Medicare has already predetermined what an office visit is worth. So when they get that bill from that doctor for $300, they're going to turn around and say this office visit is worth $100. And they're going to pay 80% of $100. So Medicare pays the doctor 80% directly. They send the balance of 20% for that $100 to your supplement. The supplement pays the other 20% to that doctor directly. The doctor gets paid a total of $100. He's paid in full. That other $200, or the doctor gets paid $100, he's paid in full. The other $200 that he billed Medicare goes away as if it never existed. And the doctor is okay with that because he accepts assignment. The other kind of doctor does not accept assignment, but it basically works the same way. You go for an office visit, that doctor bills Medicare $300. Medicare is still going to turn around and say this visit's only worth $100 and pay 80% of that. Supplement pays the other 20%. However, even though the doctor knew he was only going to get approved for $100, Medicare allows that doctor to charge you 15% more than what Medicare allowed. So before you leave that office, the doctor is going to ask you to pay $115 for that visit. When the doctor bills Medicare, Medicare is going to process that claim and see that that doctor does not take assignment and assume that that doctor charged you before you left the office. So Medicare is going to process the 80% for that claim and pay you 80% of $100 directly. They're going to send the balance to the supplement. The supplement's going to send you the other $20 directly because everybody's assuming you paid the doctor before you left the office. If you have a plan that includes Part B excess coverage, and there's only one of them, not only will your supplement pay the 20%, but they'll also reimburse you the extra 15% you paid that doctor up front. So basically that's how that works. And again, that's the difference between a doctor taking assignment and a doctor not taking assignment. Fortunately, in the El Paso County area, most doctors do take assignment, but you never know. You may run into a doctor here and there that does not. If you're ever asked to pay for an office visit in whole up front, that's probably why. But as long as you have Medicare and a Medicare supplement, especially a supplement with that Part B excess benefit, you will get reimbursed everything that you paid up front. We go further down the list and we look at plans K, L, and M. You'll notice plans K and L pay benefits at less than 100% after Medicare. So they pay most Part B benefits that Medicare left over the 20%. they'll pay at 50% or 75%. For skilled coinsurance, they'll pay 50% or 75%. Your inpatient hospital deductible pays 50% or 75%. Because these plans do not pay 100% of what Medicare left over, they are much lower in premium, and they do have maximum out-of-pockets, meaning if what you paid out of pocket in the 50 or 25% that was still left over accumulates to the max out-of-pocket amount, which is kind of high, $6,620 for Plan K, $3,310 for Plan L. If there's still time left in the year, that plan would start paying benefits at 100% until the first of the year. Plan M and N are pretty basic. Plan M pays 100% for Part B benefits, 100% for skilled nursing coinsurance, but only pays 50% of your hospital deductible. It does include foreign travel emergency reimbursement. Plan N, as in Nancy, is becoming pretty popular. It does pay 100% for Part B benefits, except for office visits and emergency room visits. For those two specific services, they apply a $20 copay. So if the 20% Medicare left over for an office visit is greater than $20, you'll probably get a bill for $20. If the if the 20% left over after Medicare for a Part B service is less than $20, you're probably still going to get a bill for $20 for a copay. Same thing for ER. Every other Part B service is covered at 100%. Covers 100% for skilled care, covers 100% for Part A deductible, includes the foreign travel emergency. Those are your plan levels to choose from. Now I skipped over Plan C and Plan F, and they're shaded in gray, and that is because there's a limited number of people who can actually purchase those plans. Those plans are no longer available to be purchased by anybody who has turned 65 after January 1st of 2020. If you turned 65 and were eligible for Medicare before January 1st of 2020, you still have the ability to purchase a Plan C or a Plan F. But if you've turned 65 after January 1st of 2020, those plans are no longer an option for you. You'd have to choose from any of the other plans that are available. So hopefully that makes sense. So I will pause here to see if there are any questions. Again, if you have a question, you can unmute or chat it in the box. I know that was a lot of information to take in a short amount of time. I do have one question in the chat. Which program has Part B excess coverage? So for Medicare Supplement plans, Plan D, Plan G, Plan N, and Plan M include, Plan G only includes Part B excess coverage. No other plan would reimburse you that extra 15% if you go to a doctor that makes you pay up front. So only Supplement Plan G would include that reimbursement. So this would only be a benefit you get if you purchase a Medicare Supplement in addition to your Part A and Part B of Medicare. So hopefully that answers that question. Any other questions or comments? That was a lot of information in a short amount of time. Oh, I got another question in the chat. Why is there an asterisk next to Plan F and Plan G? Thank you for bringing that up. Plan F and Plan G are also available in a high deductible option. What that means is you can purchase a Plan G that has a high deductible. It's much lower in premium, but that means you have to pay the balance after Medicare. You have to pay your hospital deductible. You have to pay skilled nursing coinsurance until you've spent the high deductible amount, which for 2022 is $2,490. If you purchase that plan, you spend out of your pocket the $2,490 with that high deductible plan. Once you've met that high deductible amount, then that plan would start paying benefits at 100% for the rest of the year after Medicare. And then come January 1st, it would start all over, where you'd have to meet another high deductible. Typically, I don't tend to encourage people to look at those plans too closely. And again, there's an asterisk next to both F and G. If you are eligible to purchase a plan F, you would also be eligible to purchase an F high deductible. If you're not eligible to purchase an F, you would have G or G high deductible. Again, I don't encourage people to look at high deductible plans too hard, simply because the $2,490 deductible amount is usually going to be higher than paying the full premium for a plan that pays 100% after Medicare. So they're not very cost effective, honestly. But that's what those asterisks refer to. So sorry I didn't mention that sooner, but thank you for bringing it up. Hopefully all that makes sense. Another question, are there any other methods to gain coverage for foreign travel? Not through Medicare. So again, Medicare coverage stops at the border or boundaries of the United States of America and or our territories. If you intend to travel overseas or out of the country, what I encourage you to do is look at travel insurance, preferably travel insurance that pays at the time of need, because there's also travel insurance that you can buy that you would have to go through that same reimbursement process. You wait till you get home, you submit the receipt, and hopefully they'll reimburse you. But other than buying travel insurance, there's not any other health insurance options that I'm aware of for traveling out of the country. Another question, if A and B premiums are deducted from Social Security, buying a supplement also require premium payments. So yes, this is private insurance that you have to purchase separately in addition to what you pay for Medicare Part B. And it does have a monthly premium. Let's go to the next slide. In that handout, this one, halfway through that handout, you're going to start seeing these charts. And these charts are going to be your listing of all the companies that are licensed to sell Medicare supplements in the state of Colorado in alphabetical order, 2 pages. So this first page is just half the companies that are licensed to sell this kind of coverage in Colorado. There's a lot of them. You'll see across the pages, A through N, just like on the chart we were just looking at. If you intersect a plan letter designation, for example, we'll look at Plan G. If you go down column Plan G and you intersect it with any of the companies that are on the left-hand side of the page, we'll look at, let's look at Cigna. So if we go across, we go Cigna, go across, intersect it with Plan G column. If there's a number in that box where those two intersect, what that represents is an approximate monthly premium for that plan with that company. When I say approximate, what I mean is ballpark. These are not exact premium quotes. They're not designed to be. Because first of all, you'll notice that across the top, at the very top of the page, not only does it say age 65, so each page that you look at is going to be designated by an age group of 5 years. But under that, it says monthly premium rates for non-smoker in zip code 80202. So these price estimates were gathered in a Denver zip code for a Denver zip code. And again, premiums can vary from zip code to zip code, but it's going to be in the ballpark. It's going to show you what companies charge more, what companies charge less. When you are looking at purchasing a Plan G is a Plan G is a Plan G, no matter who you buy it from. It's the same plan. A Plan N is a Plan N is a Plan N. Plan A is a Plan A is a Plan A. Again, they're all selling you the same plans based on this chart right here. They all have to sell you exactly these plans as they're laid out on this chart. They cannot add to these plans, subtract from these plans, or alter them in any way. They're set in stone. So every company is selling you the exact same product. But price, again, does vary from company to company and product to product, or level of coverage to level of coverage. So it does pay to shop around. And what this handout gives you is a tool to try and figure out what companies you might be more interested in looking at or talking to. There is no advantage to paying a higher monthly premium with a company for the same plan that you can get at a lower premium with a different company. So it does pay to shop around. Is one company better than another? Not really. They can all only do exactly what they're designed to do. If Medicare pays first, if your plan covers that benefit, the plan pays second, period. They cannot deny a claim if Medicare paid their part. So it's not a matter of one company does better business or is better at paying claims. They all do exactly the same. It pays to shop around. And yes, to answer the next question, if there is no price where the plan and the company intersect, that means that that company does not sell that plan. And there are a lot of blank boxes on this handout. You'll notice that every column, every box under Plan A is got a number in it. Every box under Plan G has got a number in it. Almost every box under Plan N or Plan F has a number in it. Companies are only required by law to sell Plan A if they want to call themselves a Medicare Supplement insurer. Every other plan they can pick and choose from, but they must sell Plan A as an option. And you'll notice many companies choose not to sell a lot of the other plan choices. Most companies will choose to sell a Plan G because it is currently considered the Cadillac of Medicare supplements. It gives you the most coverage for the best price for people who are just becoming eligible for Medicare at 65. Plan N is also very popular, and most companies choose to sell that plan as well, simply because it's a pretty basic plan, but because it covers only half, or it covers everything except copays for office visits and emergency room visits, the premium can be much lower. So it's become very popular, I think, because people are used to paying copays. Makes sense to them. But only a few companies cover or offer any of the other options. It's up to you as to what level of coverage or what option is going to work best for you for the long haul. And when you're looking at this kind of coverage, when you're looking at any kind of coverage to go with your Medicare, you probably should be thinking about the long haul. The thing about this kind of coverage is once you're in, you're in. Once you've enrolled in this kind of coverage, the only reason you could ever be disenrolled is if you stop paying the premiums. However, once you're out, you could be out. And getting back in could be difficult if you have pre-existing health issues. Again, that's where underwriting comes back in. That's where taking advantage of guarantee issue window of 6 months comes into play, especially for people with pre-existing health issues. So once you're in, you're in. Once you're out, you could be out. There is no annual enrollment period for these kinds of plans. There is no annual opportunity to make a change. Once you're in, you're in. Once you're out, you could be out. So it becomes a decision that is probably going to need to be a comfortable decision for the long haul. This is the kind of coverage you want. This is the kind of coverage you're going to be comfortable with for the next 20 or 30 or longer years. Any other questions about any of this?
Can I ask a question?
Absolutely.
You might have covered this, and I apologize. There's been so much information. It's just, you know, my brain is like turning to oatmeal. So if I'm working when I turn 65, so I won't be, you know, signing up right away for, you know, A and B.
Mhm.
And let's just say I work till 66 and a half. And as I think I understand it, so or 67 or whatever that age is, then when I stop working, that's when I would perhaps sign up for Medicare. And at that point, because I would no longer have my work insurance, I would then also be eligible for the supplemental plans as well.
Correct.
It's all tied together, regardless of when regardless of my turning 65, if I'm still working and covered.
Correct, because until you actually are enrolled in both A and B of Medicare, you can't enroll in this other coverage. So regardless of why that enrollment was delayed, as long as it's a legitimate delay, once you enroll in Medicare, that's when your clock starts ticking.
Okay, that's what I thought. Thank you.
Yep, you're welcome.
Can I ask a similar question?
Absolutely.
I'm self-employed and I turn 65 next January, end of next January.
Okay.
So, you know, from what I understand, I need to get on Medicare and get a Medicare supplement, which is what I plan to do. Because
Okay.
I'm self-employed. I'm not going to take Social Security till full, whatever you call it, my
Full retirement, yeah.
yeah, which won't be till 66 and 8 months. But I do want to get on Medicare and I can get a supplement. And so he was employed by somebody else, so he could be getting coverage, but I'm not. I'm just on the affordable health care.
Yeah, and because you're not covered by a large group employer, health insurance,
Okay.
you are strongly encouraged to go ahead and enroll in Medicare as soon as you're eligible, because the coverage that you have now is not going to be considered a credible reason, even if you continue to work. The coverage you have now, because the employer is small, i.e. self, any company that has less than 20 employees, that coverage is not going to be considered a good enough coverage to delay enrollment in Medicare.
Okay.
So if you work for a company or you're self-employed and there's less than 20 employees, you are strongly encouraged to go ahead and enroll in Medicare when you're first eligible, and whatever other coverage you deem appropriate. If you work for a company with more than 20 employees, you can delay enrollment into Medicare.
Thank you. Can I ask a quick follow-up?
Sure.
I missed the first section, which I'm gonna, your assistant gave me the link. I'm gonna go back and watch. But I have like 3 months before my birthday and 3 months after to enroll, right? So if let's say I enroll in December of this year and my birthday is the end of January, it doesn't become applicable or in effect until my 65th birthday. Is that correct?
Medicare cannot go into effect any sooner than the first day of the month of your birthday.
Okay, so January 1st, it would be
Yeah,
effective?
so January 1st, unless of course your birthday is the first of the month, the first day of the month, and then it goes into effect the month before. But also keep in mind that if you choose to enroll the month of your birthday or any of the 3 months after that, there is a delay time in when Medicare starts as well.
Okay.
So if you wait until January to enroll in Medicare, it won't start until February.
So I need to do it in December. Got it.
Yep.
Thank you so much.
You're welcome. And then, as soon as Medicare is going to go into effect, that's when you can start shopping around for whatever else you want to go with it, so that you can coordinate that other coverage to also start on the first day of that month, so that you have no gaps in coverage. So you can absolutely, when your Medicare is going to start, whether it's your birthday month or the month you plan on retiring or whatever, that's when you can start looking and shopping these other coverages, so that they can also start the first day of that month when Medicare goes into effect, so that there is no gap in coverage. There is no lag in when other coverages start.
Got it. Okay, thank you.
Yep. A couple more questions in the chat real quick. So Part A and Part B are not the same as Plan A and Plan B. That is absolutely correct. So you have Medicare parts, that's your A and B. You have supplement plans, and that's your additional coverage to go with A and B. I know that gets a little confusing because those are so similar, but yeah, you are correct. And then the last question, is there an age when you can earn as much as you want without paying taxes? Well, that really depends. Probably not. If you are 80 years old and you're making $150,000 a year working, you're still going to have to pay taxes, even if you start collecting Social Security. However, if you are not working, or you're working very little, and you are collecting Social Security, or Social Security is your sole income, you don't have to pay taxes on that. Because honestly, Social Security income is tax dollars, and they can't tax dollars. So if your sole income is Social Security, you probably don't have to file taxes anymore. If you have any other reason you would need to file taxes, such as investments, employment, anything like that, then yeah, you would have to file taxes. There isn't a such thing as an age where you can earn as much as you want without paying taxes, but there is a situation where if you start collecting Social Security before full retirement age, if you're still working and earning income and you're collecting Social Security before full retirement age, Social Security could potentially be reduced because of work income. So you're limited to how much you can make in work income without it affecting your Social Security income until a certain age. But once you reach full retirement age, it no longer matters how much you make, you'll still collect your full Social Security income. It won't be reduced based on work income, if that makes sense. But no, as far as paying taxes, if you have a reason that you need to file taxes based on income or investments or whatever, you probably still need to file taxes. It just means that your Social Security income may not be taxable as part of that. All right. So hopefully I caught all the questions and we will move on. All right. So that was Medicare supplements. Now we're going to talk about Medicare Advantage plans. This is a totally different animal, totally different kind of coverage. So Medicare Advantage plans. When you enroll in a Medicare Advantage plan, that plan is being offered by a private insurance company, but that company has contracted directly with Medicare to act as Medicare on their behalf. When you enroll in a Medicare Advantage plan, you still have original Medicare A and B. You still pay your original Part B premium. But that plan takes over those benefits when you enroll in it, and they are in control of managing your A and B benefits. That's why these plans have sometimes been referred to as replacement plans, because they take over managing your Medicare. Even though you still have original A and B, you still pay the premium. This plan now becomes the manager of how those benefits can be used. Regardless of that, you still have all the rights and protections afforded to you by Medicare. You are still given all the Medicare services that original Medicare provides through these plans, but these plans may offer extras, benefits in addition to what original Medicare would have covered, such as routine vision, hearing, dental, free gym memberships, and oh so much more if you listen to all the commercials on TV. A big advantage to Advantage plans is that these plans usually include drug coverage, Medicare Part D, at no extra cost. The thing to remember about supplements, they do not include drug coverage. You have to buy a Part D plan in addition to your original Medicare, your supplement, and a separate Part D. Advantage plans tend to include Part D at no extra cost. Who can join the Advantage plan? Well, pretty much, again, anybody who has Medicare Part A and Part B both is eligible to enroll in an Advantage plan, but there are some other limitations. For example, you must purchase a plan that's available for sale in the county you reside in. Plan choices vary from county to county in every state. So not all plans are offered in all counties. So you have to purchase an Advantage plan out of the options available in the county you reside in. For all intents and purposes, that is going to be your service area, your county of residence. And there are potentially limited enrollment periods for Advantage plans. So the enrollment periods that apply to Advantage plans, obviously your initial enrollment period, you just became eligible for Medicare or you're becoming eligible and enrolled in Medicare. That's that 7-month window, the 3 months before, the month of, and 3 months after. Any time during that 7-month window, you can enroll in an Advantage plan. Outside of that 7-month window, or once you're enrolled in that plan, you are eligible only to change that plan during annual enrollment periods. So Medicare Advantage plans do give you the option of making a plan change every year during enrollment period. The annual election period, what we tend to refer to typically as just open enrollment, is in the fall of every year. Then Medicare a couple of years ago started a new enrollment period just for people enrolled in Advantage plans that extends that fall enrollment period. And then there, with Medicare, most Medicare things, there are always exceptions to the rule. So special enrollment periods may apply to make a plan change with Advantage plans as well. So the annual election period, again, I simply refer to it as open enrollment. That is going to be the October 15th through December 7th enrollment period, happens every year. During that window, you can either get into, get out of, or switch from one plan to another for both Advantage plans and Part D plans, standalone Part D plans. Any change you make during that time frame goes into effect January 1st of the next year. So again, the annual open enrollment, you can change, you can get into or out of both an Advantage plan or a Part D plan between October 15th and December 7th. If, as of January 1st of any year, you are enrolled in an Advantage plan, so whether you enrolled during open enrollment to be effective for January, or you've been in an Advantage plan and you're still in it come January, between January 1st and March 31st now, there's an additional window of opportunity for only people in Advantage plans to get into, or I'm sorry, to get out of their Advantage plan or to switch to a different Advantage plan. So this basically gives you an additional 3-month window to make a change. So if you get into an Advantage plan to be effective for January 1st, and come the end of January, you decide, what the heck am I doing? I don't like this, and you want out, you can get out between January and March. If you're in an Advantage plan and you decide you don't like that plan, you want to try a different one, you can change to a different one during those 3 months. If you're not in an Advantage plan as of January 1st of the year, this enrollment period does not apply. You can't do anything. You've already done your thing. But this does give people an additional opportunity to either switch to a different plan with or without drug coverage, or get out of that plan altogether, go back to original Medicare and enroll in a separate Part D so you still have drug coverage. And again, this just was started in 2019. And then there's special enrollment periods. A special enrollment period can apply to an Advantage plan in several different ways. If you are enrolled in an Advantage plan and you move, so say you enroll in an Advantage plan here in El Paso County, and in June, you decide to move to Pueblo. You purchased a plan in the county you resided in, and when you moved, you left that county, you cannot take your plan with you. It's only good in the county you bought it in. Because you cannot take it with you, Medicare considers that involuntary loss. It's not your fault you can't take it with you. Because it's involuntary loss, what that means is when you get to Pueblo, you have the opportunity to either purchase a plan, an Advantage plan available in Pueblo, whatever options they have in Pueblo, or it gives you a window of opportunity to be guaranteed issue into a supplement. So that is one of the ways, one of the other ways you can have a window of guarantee into a supplement. If the plan that you're currently enrolled in El Paso County decides that they're leaving the county, they're not making enough money in this county, they're getting out. That is also considered involuntary loss. It wasn't your choice. That gives you an opportunity to either get into another Advantage plan that is being offered in this county, or it gives you an opportunity to have guarantee issue into a Medicare supplement, or any other loss of credible coverage, such as lost employer retirement benefit, lost employment coverage, whatever. The other most common special enrollment opportunity you may have is with a test drive. And I mentioned this briefly in the last section, said we would talk about it more in this section. What a test drive is, or a trial right, is to give people an opportunity to test out a Medicare Advantage plan to see if that's the kind of coverage that's going to work for them for the long haul. Advantage plans are not for everybody. Supplements are not for everybody. But this gives you an opportunity to try out an Advantage plan before you're committed to being possibly limited to this kind of coverage. The way a test drive works, you can use it in one of two ways. If you are just becoming eligible for Medicare, enrolled in Medicare, and you go straight into an Advantage plan, you have up to 12 months to test drive that plan. If at any point within that 12-month window from the time you enrolled, you decide that that plan is not for you, you'd rather have a supplement, you can get out of that plan, even if it's not an enrollment period. You can get out of that plan and still have guarantee into a supplement. This test drive, when you first become eligible and enrolled in Medicare, coincides or coexists with the 6 months of guarantee issue into a supplement that we talked about a few minutes ago. So basically, a test drive can potentially extend that 6-month window of guarantee into a supplement for up to 12 months. Because you have up to 12 months to test drive this Advantage plan when you first enroll in Medicare. The other way you can use this test drive is if you become eligible for Medicare, you enroll in Medicare, and you enroll in a Medicare supplement from the get-go. You enroll in the supplement, you maintain that supplement without any break in coverage for a couple of years, and you get tired of seeing the commercials, you get tired of all your friends talking about Advantage plans, you decide you're going to go for it, you're going to try it out. You can drop your supplement, enroll in an Advantage plan during an open enrollment period, and have up to 12 months to test drive it. If at any point during that 12 months you decide that that's not the right coverage for you, you're guaranteed back into the supplement you dropped to get it. But you have to maintain that supplement without any break in coverage from the time you get Medicare to the time you enroll in the Advantage plan. I don't know if you've noticed here, but there is a theme. And that theme is these enrollment periods, these special enrollment periods provide you guarantee issue into a Medicare supplement or the ability to enroll in another Advantage plan. But because supplements can be much more difficult to get into, especially if you have pre-existing health issues, that's why it's so important to be aware of that ability to get into the supplement. So if you're, I get a lot of people who are very, very healthy, they never go to the doctor. Advantage plans are a great option for them, saves them tons and tons of money because many Advantage plans are available at no monthly premium. And then a couple of years down the road, something happens. They develop a health issue. And suddenly that Advantage plan is costing them money. They have to pay copays to see doctors and whatever. At that point, because you've developed a health issue, it's probably too late to go to a supplement because now you have a pre-existing health issue. And that's the point I'm trying to make is that's why taking advantage of those guarantee issue periods or those special enrollment opportunities can be so important for someone with pre-existing health issues. These plans do work much differently than original Medicare and a supplement in the fact that because when you enroll in an Advantage plan, that plan becomes your Medicare A and B. They manage your A and B. They are allowed to charge different ways for A and B services. So when you enroll in an Advantage plan, instead of Medicare and your supplement paying the provider, you're going to pay a copay at the time of service, and then the plan will pay the difference to the provider. So with Advantage plans, you will typically have an out-of-pocket cost in the form of a copay for almost every service. Some plans, some Advantage plans may have a monthly premium, although I can tell you in El Paso County, there are many, many plans available that have no monthly premium. As long as you're paying your Part B out of Social Security, you can get these plans at no extra cost. They may have, with Advantage plans, maximum out-of-pocket limits, meaning you'd only be liable to pay your copays or out-of-pocket costs up to a certain amount of money per year. And if you meet that limit before the end of the year, that plan would have to start paying for any services for the rest of the year at 100% with no copays. Excuse me. But those out-of-pocket maximums can be quite high. These plans may also have some deductibles that you have to meet. Some plans do, some plans don't. Generally, again, any Advantage plan is going to provide any and all the same kind of services that original Medicare gives you. They cannot not provide a service that Medicare covers. Again, many of these plans will include Part D drug coverage at no extra cost. On the downside, you may be limited to who you can see or where you can go. When I said you had to purchase a plan that's available in the county of residence that you live in, and that is for all intents and purposes your service area, that's because these plans tend to have networks, meaning you are limited in many of these plans to going to the doctors and providers and facilities that these plans contract with. And that network of providers is your service area. Although if you have this plan and you're traveling anywhere in the United States and or territories and you have a medical emergency, doesn't matter where you at, this plan would have to cover it. But outside of a medical emergency, you typically have to stay within your service area and use providers that the plans have contracted with. And again, that's how some benefits and the cost sharing, how you pay for services with these plans is different. And just to make things more exciting, there are several different kinds of Advantage plans to choose from. You got HMOs, PPOs, private fee-for-service plans, special needs plans. There are a lot of different kinds of plans. I haven't even listed them all here. There are also savings accounts, cost plans, demonstration programs or pilot programs, and then the PACE program, which is program for all-inclusive care of the elderly. I'm going to briefly touch on each one and kind of explain the differences. If you are interested in getting a complete list of the plans available in Colorado, or specifically in the county that you reside in, the best way to do that is by getting a Medicare New Handbook. Again, you can get that by calling 1-800-Medicare and requesting one specifically for Colorado. You can go to medicare.gov and download the generic handbook as a PDF. But if you want to see the plans available in Colorado, your best bet is to call 1-800-Medicare and request a hard copy mailed to you for Colorado. So again, I'm going to briefly touch on the differences between the different types of Advantage plans, starting with HMOs. If you've ever been or had an HMO for insurance coverage, an HMO is an HMO is an HMO, and they all work exactly the same way. They are the most restrictive kind of coverage, meaning you have a copay for most services. You are absolutely limited to only using the providers and facilities that plan has contracted with. You must stay in network. If you go out of network, you have to pay out of pocket. Neither Medicare nor your Advantage plan will pay for that service out of network. You are probably going to be required to get referrals to see specialists and other services. You may be required to get prior authorization for some services. But HMOs will always include Part D drug coverage. PPOs are a little more flexible. Preferred provider network means that this particular kind of plan has a network of providers and facilities that they have contracted with that they would prefer you use. If you use their providers, their network of providers and facilities, your out-of-pocket costs, your copays will be lower. However, these plans do not limit you to just using their network of providers. You would be allowed to go out of network to any provider who's willing to accept your plan coverage and the copay that you pay them without any question. So if you can find a provider out of the network that's willing to take your insurance, you can go to that provider, no questions asked. However, your plan still determines what you pay as a copay for that service, and your copay and out-of-pocket costs do increase if you go out of network. Because you're allowed to go out of network, referrals are no longer required, but you may still be required to get prior authorization for some services. PPOs may or may not include Part D drug coverage. If you enroll in a PPO that does not include Part D drug coverage, you would not be able to get a separate Part D plan. So you'd have to have a good reason to get a plan, a PPO without drug coverage, such as you're a veteran and you use the VA pharmacy or something like that. Fee-for-service plans or private fee-for-service plans are supposed to be the most flexible Advantage plans. Basically, they are only required to contract with a single provider in a service area or a county to make sure that there is at least one provider available for you to use with that coverage. Otherwise, it becomes your responsibility to make sure that any provider that you want to see is willing to accept your coverage. Because there are no contracts, no contracts with providers and facilities under this kind of plan, if you can find a provider willing to take this coverage, that does not mean they'll have to take you a second time. So you'd want to be very comfortable that your provider is willing to keep you as a patient in this kind of plan for either a multiple visit need or over a amount of time, a year or more. Because there is no network of providers required with these plans, no referrals are required, prior authorizations may still be required for some services. The plan still sets the copay amount that you have to pay for services. And the provider has to be willing to accept that copay plus whatever the plan chooses to pay them in order to take you as a patient. With these plans, they also may or may not include Part D drug coverage, but if you get one of these plans that does not include Part D drug coverage, you would be allowed to purchase a separate Part D plan to have drug coverage. But again, there's no network, there's no contracts, and providers could potentially choose to take you one day for service, but not the next time you need service. It's a case-by-case basis, they can make that choice. Special needs plans are basically Medicare Advantage plans designed for a specific population. And that's going to be for people who are eligible for both Medicare and Medicaid, or who reside in certain types of long-term care facilities, or have qualifying chronic health conditions. These plans tend to be very, very, very specific in that criteria. They're not available in all counties. They're typically only available in the more metro urban areas of Colorado. Again, if you want to find out the specifics of those plans and who's available and where, you can call it 1-800-Medicare and request a Medicare New Handbook, or you'd be able to go to the Medicare website and use their plan finder, which we'll talk about here in a little bit. Cost plans, I'm not going to talk about a lot because they are being sunsetted or phased out by Medicare. PACE, the program for all-inclusive care for the elderly, is still available. Again, primarily available in the Front Range area, the metro urban areas. Basically, PACE program is a Medicare HMO Advantage plan on steroids. So again, this is a plan that's designed for a very specific population, and that population is primarily going to be people who have Medicare and long-term care Medicaid. And this plan is designed to help people stay in the community versus going into a long-term care facility. So it provides some additional benefits to that population by providing some case management, may provide transportation services, that kind of stuff. Social services designed to keep someone in the community when otherwise they would probably have to go into long-term care of some sort. Okay, your rights in a Medicare Advantage plan. You absolutely have all the same rights you have as original Medicare and all your protections. You have additional rights and Advantage plans to have access to healthcare providers. So if you ever enroll in an Advantage plan and you can't find any providers anywhere in your county that will take it, that's a problem that you should probably report to Medicare or give us a call. You actually have a right to know how doctors get paid in these plans. You have a right to fair and efficient and timely appeal processes and fast appeals in certain settings. You always have the right to get the care you need. You have the right to receive information in easy to understand language about your plan. And of course, you have the right to have your medical information kept private. All right. I'm going to stop there to see if there are any questions. I know that's a lot to digest. I do see some questions in the chat. So let me address those. So first question, if you take Medicare Supplement plan in at the time you turn 65, can you change the Medicare Supplement to say a plan G when you turn 85, as long as you don't go out of A and B? Or can you never change the supplement plan even if you stay in Medicare? Okay, so when it comes to Medicare supplements, again, it's a choice that you need to be comfortable with for the long haul because of underwriting. So if you're outside your guarantee issue window of 6 months, you're not in a special guarantee window for a supplement. Once you're in, you're in. Once you're out, you could be out. You are subject to underwriting, even if you're trying to change to a different plan level within the same company, especially if you're trying to upgrade that coverage. So if you started at a plan in, and that is good enough coverage for 10, 15 years, but you are getting older, you're using more services, you want to upgrade it to a plan G, you would be subject to underwriting. And if your health issues are significant enough that the company doesn't want to let you do that, they don't have to let you do that. If you have a plan in with one company and you want to try and change to a plan G with another company, same thing, subject to underwriting. So unless you manage to fall under a special guarantee issue window of some sort, pre-existing health concerns will always come into play when you're trying to change anything as part of your Medicare supplement. So hopefully that answers that question. Which document is this? I'm not sure which document you're referring to, Marianne. Maybe you can clarify.
No, that's all right. My printer wasn't working. I'm on the right document.
Okay, cool. What if you move from that county? Do you need to repurchase or does the plan follow you? Okay, so if you're in an Advantage plan, say you enrolled in a plan in El Paso County, you decide to move to Pueblo. Again, you can't take your plan with you. When you get to Pueblo, you can look to see what plans are available in Pueblo and you enroll in a new plan in Pueblo. And that's whether you're going from one county to another or from one state to another. You cannot take the plan with you from the county that you were living in. When you get to the new place, you enroll in whatever available in that new county or new state or whatever. Or you have guarantee issue into a Medicare supplement. But the plan does not follow you. You have to leave it in the county you left when you moved. Next question. A friend told me that her mom had Kaiser Medicare Advantage and that her skilled rehab benefit had about 20 days allowed with Kaiser versus 60 or 90 days with regular Medicare. Is that possible? No. The answer to that is no. What may have happened, because Advantage plans are always going to follow the same model of benefit coverage as original Medicare when it comes to skilled care. So this is one of the benefits that you're probably not going to see any difference between what Medicare pays or what the Advantage plan pays. Medicare, again, will cover the first 20 days at 100%. Most Advantage plans will cover the first 20 days at 100%. Starting at day 21 of a continued skilled facility stay, Medicare starts applying that daily coinsurance, $194.50 a day right now. Advantage plans will also apply the $194 daily coinsurance starting at day 21, unless they have a slightly different formula. It could be a fewer days before you start paying that coinsurance. It could be more days before you start paying that coinsurance. But what you need to understand about that particular benefit, whether you have an Advantage plan or original Medicare, is Medicare or the Advantage plan are only going to cover someone in that situation, in a rehab situation for recovery or rehab, for as long as that stay is needed or is necessary. What that means is if you're in rehab and you're getting physical therapy, and that physical therapy has improved your condition enough to send you home, that's when Medicare stops paying. And that's regardless of whether or not you've been there a week or you've been there 6 weeks. As soon as your therapy has progressed to the point where you're good enough to go home, that's when Medicare cuts off. Doesn't matter how long you've been there. On the other hand, if you are in that rehab and you're getting physical therapy and your condition is not improving, and you're getting onwards to 100 days in that facility and you've not improved enough to go home, that's when benefits, you have to start worrying about that benefit expiring, because even an Advantage plan is not going to extend that stay more than 100 days. So when you say that, 20 days versus 60 or 90 days with regular Medicare, Medicare or the Advantage plan will cover all or part of up to 100 days at a time, period. Medicare and Advantage plan, 100% for the first 20 days. After that, there's co-insurances that will start being applied per day. How long someone is there or how long Medicare or the Advantage plan will continue to pay for someone who's there depends on how well they're progressing, period. So both Medicare and the Advantage plan cover up to 100 consecutive days as long as you need that much time. But if you need less time, that's when they'll stop paying, is when you no longer need or qualify for that care because you've improved enough to go home. So hopefully that answers that question. And then the last one looks like supplement requires underwriting and decide not to accept you during your initial sign-up period. Can you get an MA after the initial sign-up period is over? So if you're being denied a supplement during your initial sign-up period, meaning once you're enrolled in Medicare A and B, you're in your 6-month window of guarantee issue, and you're being turned down by a supplement, you should call the state of Colorado's Division of Insurance, because they're not allowed to do that. Again, you have 6 months from the time your A and B go into effect to have guarantee issue, no questions asked. You can enroll in any plan with any company. Nobody can turn you down as long as you do it within that 6-month window. If you're being turned down for any reason, there's a problem. However, if you are outside of your guarantee issue window, or you're not in a special enrollment of guarantee issue window, you can enroll in an Advantage plan during any open enrollment period. So whether it's the October 15th through December 7th window, but you don't get a special enrollment period just because you're being turned down for a supplement, especially if it's during your initial guarantee issue window. So hopefully that makes sense, because that shouldn't happen. If you miss your guarantee issue window into a supplement, you didn't enroll in an Advantage plan, you would have to wait until the next annual open enrollment period to get into the Advantage plan, basically. And in the meantime, you would just have original A and B of Medicare. The enrollment window for Medicare Advantage plan when you first become eligible for Medicare is 3 months. So you get that same 3-month window, the month of and 3 months of your initial enrollment window into Medicare. Once you're enrolled in Medicare, you have 3 months to enroll in an Advantage plan if you choose nothing else. You have 6 months from that same start period to have guarantee issue into a supplement. If you miss both of those, the next thing you can do is enroll in an Advantage plan or a Part D plan during the next open enrollment window, October 15th through December 7th. So hopefully that makes sense. I know these enrollment periods and enrollment windows and guarantee issue periods can get a little confusing, but certainly anytime there's any additional questions or any additional need for clarification, just because it is all so jumbled up, you're always welcome to call us or shoot us an email, and we'll walk through it again. One more quick question. Let's say I shop around and find a good premium on a supplement. Can the supplement insurance plan raise their rates, or are they allowed to only raise rates at a fixed amount per year? That's a good question. These are insurance companies. They're private insurance companies that you're purchasing a private insurance policy from. They are going to raise rates on an annual basis at minimum. On the other hand, there is no limit to what they can raise their rates at, but any rate increase with any of the companies that sell these plans must be approved through the Division of Insurance up in Denver. So they can't just willy-nilly say they're going to raise your rates $100 from one year to the next. Their rate increases must be approved and justified to the Division of Insurance. So you're not going to see a $100 a month jump because the Division of Insurance would never allow that. Typical annual premium increases are going to average between 6 and 15% per month. And you can guarantee yourself at least one premium increase per year, typically either at the first of the year, on January 1st, or they may wait until your anniversary date. So if you turn 65 and got a supplement in June, they may wait to increase your premium until the following June. But there will be premium increases, and you should definitely budget for that.
Can I ask a question?
Of course.
This is scenarios based on what happened to a friend of mine.
Okay.
She got a Medicare Advantage plan, supposedly a good plan, but she didn't think she could afford the Medicare and the Medicare Supplement. She was healthy. Fast forward 6 years, she gets cancer. She had thousands of dollars of copays. And so does that mean she's now stuck with the Medicare Advantage? She can't, like an enrollment period, go back to Medicare and a supplement?
She can always go back to original Medicare during an enrollment period, because she can always get out, but she's not going to have guarantee into a supplement. No, because now she has a pre-existing health issue and she can be turned down because of underwriting. The only way to avoid that is if she can manage to somehow fall under a special enrollment window, such as, you know, she gets lucky enough that the plan leaves the county she lives in, or, you know, she moves out of the area and gets a guarantee issue into a supplement somehow. But just based on the fact that now she needs better coverage, that's usually the worst time to try and get better coverage.
Got it. Thank you so much.
Fortunately. And unfortunately, I hear that story a lot. Again, these plans, especially the zero premium advantage plans, can save you a lot of money. But you have to be prepared for the worst case scenario, that if something happens, would you be able to afford the copays, the out-of-pocket costs for these plans? Supplements aren't cheaper because you're going to pay a high monthly premium every month, whether you use that coverage or not. And you have to decide whether or not you can afford to pay that high monthly premium that will increase every year, every month, for as long as you have it, whether you're using it or not. Versus the other hand, you pay little or nothing for the advantage plans for as long as you're not using it, but can you afford to, you know, pay for services if something catastrophic happens? So the bottom line is they get you one way or the other. One way or the other, you're going to end up paying. That's just how our healthcare system works, unfortunately. And it's just a matter of trying to decide what scenario is more comfortable, both mentally and financially for you. And unfortunately, that's kind of what it boils down to. All right. So we'll go ahead and try and wrap this up and get you guys out of here if there's no other questions. So, advantage plans. They are required to follow a lot more rules than other kinds of coverage, especially when it comes to marketing. I have included a couple of handouts in the email that I sent regarding marketing do's and don'ts, what they can and cannot do when it comes to trying to get you to buy this kind of coverage. There are a lot of don'ts. They cannot approach people in common areas. They cannot approach you on sidewalks, lobbies, hallways. They cannot send you unsolicited text or make unsolicited calls, so no cold calling. But they can send you junk mail, just like anybody else, via email. They can send you junk mail through snail mail, just like everybody else. They cannot use terminology that describes their coverages as free, just because it has zero monthly premium. They cannot require you to sign anything just to attend an event, such as a sign-in sheet. So if they're advertising that they're going to have an educational event to tell you everything you need to know about Medicare, basically what we're doing here today, they cannot make you sign in to attend that event. Same thing for an advertising event or marketing event. They cannot camp out in medical offices. They cannot camp out at pharmacies. You know, if they have a table and some brochures and a tablecloth and they're sitting inside your pharmacist's office or pharmacy, that's not okay. Obviously, they're not allowed to misrepresent benefits. They cannot conduct marketing and educational events at the same time. They can't provide meals if you go to a marketing event. So they cannot offer you free dinner if you come and attend and let them talk about their coverage. They're not allowed to do that. Cannot offer free services or items greater in value than $15. They cannot go door to door. They cannot get into an apartment complex and just start knocking on people's doors. That is not allowed. There are lots and lots and lots of things they're not allowed to do. Please, 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 if anybody ever witnesses anybody doing any of those things, call us. If you don't speak up, nobody speaks up, they're going to keep getting away with that stuff and they shouldn't be allowed to. Things that they must do: they must always submit any Medicare or any marketing material to Medicare for approval. That includes commercials, radio advertisements, print advertisement. They are absolutely supposed to be complying with the do not call registries. They must obtain a consent to contact you. So if you go to a marketing event and you go up to them and say, I'd like to get more information, I want to schedule an appointment with somebody, they can do that because you came up to them. They schedule the appointment. They have to have you fill out a form called scope of appointment that tells you what they're allowed to talk about at that appointment. They're not allowed to market multiple products during an appointment that you scheduled initially for just Advantage plans. So lots and lots of things they're not allowed to do, lots of things they're required to do. Please refer to the handouts that I included in the email I sent earlier. Lots of good information. Please, please, please report, even if you just call us to let us know so that we can put it on our radar. We're happy to take that information all the way up to helping you file a complaint, depending on the situation. But I would strongly encourage you to keep an eye out. And if you witness anything that is not allowed, please let us know. All right, so last bit, things that you need to think about before enrolling in Advantage plans. If you get an Advantage plan that includes drug coverage, please make sure that that plan specifically covers your medication needs. And we will talk about this in much more detail next week when we talk about Part D coverage and how it works, because it works exactly the same way in Advantage plans as it does through standalone drug plans. But it's very important to make sure that whatever plan you get is going to cover your specific medication needs. If you have a plan that is a network, but you already have a doctor that you want to keep, you might want to make sure whether or not that doctor takes any of those plans that you're looking at. If your doctor does not participate with any of the Advantage plans that you are looking at or get enrolled in, you can no longer see that doctor. Or you have to pay out of pocket. Medicare won't cover it. If you have a hospital network preference, I know in the past, many people have had a preference between our two hospital networks here in Colorado Springs. Some people have very strong opinions. I don't know if that's so much these days, but if you have a preference, make sure the plan participates with that hospital network. And then anything else you need to know. Now, I know there's lots and lots of commercials these days about all the extra benefits that these plans can offer you: dental, vision, get your Medicare premium paid back to you, all those wonderful things. However, keep in mind that not all of those benefits are available in all plans. Even if a plan offers it, it may not be a plan available in your county. Even if it's available in your county, it may not provide all of the coverage that you have been blasted with on TV. Plans make a lot of promises, but if those are the kinds of benefits you're interested in getting out of a plan like this, please ask very specific questions when talking to any representative of these plans and get specific details. Make sure you ask them about providers in their network that can offer those services that you're looking at, such as, what kind of dental network do they have, who they contracted with. If you want the dental benefit, but you don't go to a doctor or a dentist that they have contracted with, that benefit does you no good. You have to use their contracted dentists, kind of thing. So keep those kinds of things in mind and ask lots and lots of questions and get lots and lots of very specific information. These plans offer more and more and more benefits every year. So many more that we can't keep up with them. I mean, there are plans that I found out offered benefits that I'd never even heard of well after open enrollment ended, because there are just so many things that they are allowed to offer these days. And it's hard to tell who offers what until you talk to that plan specifically. And there are a lot of plans available. In Colorado alone, there are over 50 plans to choose from for Advantage plans. And again, not all 50 plus plans are available in any particular county. In El Paso County, we have 29 of those plans to choose from. In Denver, they probably have more. In Fremont County, they probably have much less plans to choose from. So it really depends on where you live as to what options might be available to you with these plans. I did send you a handout in the email that kind of goes over the differences between the different types of Advantage plans. Hopefully I'll be able to update this document one of these days. But I also sent you this handout. This handout was created by one of our volunteers, Miss Dearly, because she's no longer with us. This handout is going to give you a list of all the Advantage plans available in El Paso County only, because that's the only county I had time to put this list together for, unfortunately. But it's going to be a nice at a glance. So it's going to show you all the Advantage plans available for purchase or enrollment in El Paso County. It's going to tell you what kind of plan. It's going to tell you if that plan has a monthly premium, if it has deductibles, what the basic co-pays are, what hospital networks it participates with, what the max out-of-pocket might be, that kind of stuff. So it's a nice handout to have. It's more of an at-a-glance kind of document that you can kind of look at all the plans at a glance to see, if any of them fit your specific needs or wants criteria. I do try very hard to make this as accurate as document as possible, but if you find any discrepancies, please let us know. Sometimes plan information can change after open enrollment ends, whether that was intentional or not. It happens. But this is a nice handout to have that just kind of breaks down what's available in this county. Hopefully next year I'll be able to expand this particular handout to Teller and Park, and hopefully some of my other 9 counties as well. But this is all I had time to do this year. Again, I'm going to mention real quick the Medicare savings programs that are available for people who have limited or low income. Again, these kinds of programs, if you qualify and apply and are approved, can help cover the cost of your Medicare Part B premium, meaning they will not deduct that premium out of your check. The state will pay it for you. Or at a lower income asset level, you may also qualify for not only the state to pay your premium, but it may also act as a supplement and pay your Medicare Part B co-insurances, pay your hospital deductibles, and all of those kinds of expenses A and B left over. If anybody would like additional information about these programs, please give us a call or shoot me an email. I'm happy to talk to you about them in more detail. We do help with applications for these. And that is it. And as usual, I went over time, so I apologize. Let's take a couple more minutes to answer some final questions. So the first question, are there programs that will help low-income individuals? Yes, that is the Medicare savings programs. If you would like more information about those programs, please let us know. Either give us a call or shoot me an email. I'm happy to talk to you about them. Here's my contact information. Next questions: are plans less expensive if you are married, i.e. couples coverage? So Medicare Advantage plans, no. Some Medicare Supplement companies do offer multi-policy discounts. So if it's, two people in the same household get individual policies, you may get a discount on each policy. They only sell individual policies, but you may get multi-policy discounts. If you buy a supplement insurance from the same company, you have homeowners or car insurance, you may get a multi-policy discount. So some companies do, some companies do not. Next one, any comments on using a Medicare broker? What I can tell you about that is they're not required. You're going to pay the same premium whether you call the company directly to buy a Medicare supplement or you go through an insurance agent to buy a supplement. If you call any of the 800 numbers you see on the TV commercials, that's going to route you to either an insurance salesman for Advantage plans, or it's going to route you to a call center that will take your information and sell it to an insurance salesman for Advantage plans. They could certainly give you a lot of information about the plans that might be available in your area, but I don't know that they would give you as much information as you need. Again, you ask lots and lots of questions. There could be advantages if you want someone to break it all down for you. There could be advantages to just doing it yourself. The best way to find an Advantage plan and look at all the costs and coverage differences, or to find a drug plan and look at all the costs and coverage differences and estimate out of pockets, is to go on Medicare.gov and use their plan finder. And we will talk about that in much more detail next week when we go over drug coverage. You can always call us. We're happy to help break down the plans individually for you. Unfortunately, supplements are supplements. I'm not going to tell you one company is better than another. Same with Advantage plans. One company is not better than another. They may just offer slightly different benefits at slightly different out-of-pocket costs. And sorting through all that can be intimidating, but ultimately it's going to have to be something that you look at on a plan-by-plan basis to determine what's right for you. But we're happy to help walk you through that as best we can. That's what we're here for. We're just not going to tell you what to do. For anybody who did not receive the email that included the handouts, I will look to see what registrations I got late and try and get an email out to you before the end of the night. Let's see, anything else? And I think that's it. Any other questions anybody might have before I let you go? I agree. It's lots of information. It's brain numbing much of the time, but luckily I do this in 4 parts instead of all at once like I used to do. So it's much less information to digest at a time. Hopefully the handouts are helpful. And again, if there's any questions, any need for clarification, just want to go over it one more time to make sure you understand it properly. You're always welcome to give us a call at any time. Shoot me an email. Happy to talk about it as often or as much as you need to make sure that you're comfortable with your understanding. All right, I appreciate the comments. Last week's video should be posted on our website at any time now. I will double check with our IT person to make sure. You should have gotten an email sent to you sometime between last week and this week that provided you a link to the recording as well as a link to a survey. I will make sure that if that did not go out, it will go out, as well as the same for this week's presentation has also been recorded, and you should get a link to the recording for tonight's presentation, as well as a link to a survey. So I will make sure those go out to anybody who registered at any point.
Can you, I wasn't on the meeting last week. Can you send it out to everyone on this meeting?
Sure,
Is
had you
that-
registered, had you registered but just didn't make it?
I hadn't registered for last week, no.
Okay.
I didn't know about it until Friday of last week.
When you get the email from tonight's presentation with the link to tonight's recording, it'll take you simply to the website where the recordings are hosted.
Okay, good.
Or if you look in the chat box, Jessica has put a link to last week's handouts and the video in the chat box that you can just click on.
Great, thank you.
But yeah, those are always going to be found at our website, ppacg.org. And I believe she also posts them on YouTube on our webpage on YouTube. But again,
Thank
you can catch this link, go ahead and click on it, and that'll take you right to it. Anybody who registered, who is registered, will get an email with tonight's presentation and a link to a survey in the next day or so. So you should automatically get a link for tonight's webinar. All right. Again, I thank you all for attending and your patience, and hopefully I will see you all next week to talk about Medicare Part D. With that, I will let you guys go. Have a good night, and thanks for joining us. We'll see you next week.